Good evening, everyone. My name is Kayla, a student of Dr. Amy Potter's Online Bio 163, and today I will be discussing the nervous system with you all. Okay, and then what we have here is an interior view of your 3D model representing your skull. And here we all have a couple of regions that goes along with the functions of your nervous system. Your frontal lobe always being a big one when it comes to your nervous system, because this is where your memories and all of your personality functions and things are going to be. So that plays a good role that we'll speak about later. Posterior to your frontal lobe, you'll see your temporal lobes poking out there, and then dorsal to that, you have your parietal lobe. And when we get a more lateral view of it, you'll see your temporal lobe again. This temporal lobe is where your auditorium cortex will be located. Then we have your occipital lobe, just dorsal to your, and then inferior to your occipital lobe, you have your cerebellum. And when we come in closer, we see our medulla oblongata that is inferior to our cerebellum, which is also a part of our brain stream, along with our pons, that play a vital role in our nervous system, because essentially our nervous system it consists of our brain and our spinal cord, which our medulla oblongata would essentially connect. So here you'll see that is how that is really where it's supposed to be. It'll be there, and it'll connect with our spinal cord. So all of that plays a vital role. And so even though those are really important parts, everything comes together and plays that vital role when it comes to having a stable homeostatic regulation going for your nervous system. And what you see here would represent your cerebral spinal fluids that are basically, if we were to do a demonstration, everything is functioning and flowing as it needs to. Is cushioning certain parts of your brain that doesn't have that cushion on it, and also cushioning your spinal cord. And speaking of your spinal cord, this is your spinal cord. It is another important function when it comes to your CNS. So, which you guys is your central nervous system. And here you'll see two of your spinal cord regions out of the four. And here you'll see your cervical spinal region, spinal nerve, sorry. And here below that, inferior to that rather, you'll see your thoracics, 12 thoracic spinal nerves, with their spinal ganglias, which are these paired together. When you pair those are essentially that's what that is. And so those, when we talk about our spinal ganglias, they consist of a lot of your spinal neurons, and your spinal cord in general. Sorry, it has mixed nerves. You'll say, what's a mixed nerve? Well, because your spinal cord is also vital to your motor commands, that's what a mixed nerve is. It contains both your sensory and your motor fibers. And when we thinking about the homeostatic regulation for your spinal cord is going to be ascending and descending as it should. Ascending as in carrying your sensory information towards your brain as needed, with the assistance of your medulla oblongata. We'll get back there as well. And descending traits, as in when you are using your motor commands, bending, walking, stretching, all of that. So that is very important when you're talking about your spinal cord. And also that is, and also within your spinal cord, that is where the cerebral fluid is actually stored. It does start with within your brain. It comes from your ventricles. It is like three ventricles within the hemisphere, and it's so small because you really wouldn't be able to see it from that lateral angle unless it's a mid-sagittal cut and you're looking within the hemisphere at a lateral view, and you'll be able to go in and see that those ventricles and see exactly how and where the fluids are actually rotating from and coming down to your spinal cord and being stored within the central canal within your spinal cord. And here we have a posterior view showing how everything is functioning within your negative feedback regulation. And now I'm going to show you how we'll try to show you how everything would look if you were to be experiencing your body, if your brain was to be experiencing a positive feedback. Okay, so if we look closely, instead of our cerebral spinal fluid running back down to our spinal cord and just going in that rotation, it's actually, as you can see, just coming within and staying within our brain and just sitting around our brain, creating pressure. As you see, it's just building up. It's just sitting there. It's just, yep, just sitting there. And this right here is what you would call a rare, well, this is what you would call the brain disease called IIH. See that? It's not going to your spinal cord. Is just sitting in your brain, just sitting on your brain, creating pressure and accumulating. All right, we got a little carried away with the demonstration, but as we can see, it still is a little fluid. But like I said, in a normal in a real life situation, you're gonna see way more. It'll be way more fluid. But here we'll see how it's still fluid, just sitting in there and creating that pressure on your brain. As I said, this disease is called idiopathic intracranial hypertension. It creates that pressure around your skull due to your cerebral fluids not fluctuating and moving in the rotation as it should. It's just kind of at a standstill and building up, So to get and that also brings us to our peripheral central nerve when we're talking about this, because it's just a functional that is sort of like your homeostasis. But what's going on here is you are in a positive feedback regulation, and like I said, it'll cause you to lose that peripheral vision. It'll cause headaches and nausea, and you'll see it in certain people. And to get your body back, or get your brain back functioning and giving you that, releasing that pressure off your brain to get yourself back to that negative feedback regulation, things such as, medicine, spinal taps, and your lumbar puncture surgeries are what can help bring your body back to your normal homeostasis when you are experiencing IIH.